listen to the session very carefully. We will be discussing most of the terms. Writing will be discussed, then speaking will be discussed, and reading as well. Okay. If you have any doubts, let me know in the comments. Okay. Let me start. So, hello, good morning.
Good morning.
Yes, Monisha, how are you? I was just evaluating your writing, and what about the test? Did you attempt
Yeah, listening.
only listening?
Hmm.
And
Which you send in that one, no? OET second volume that reading.
mm-hmm.
In that A part, somewhere it's mixed.
Really?
Somewhere B. Yeah.
Uh-huh.
I took all printout and I checked it yesterday night too.
But it was
Like some of the part, yeah. A part half is there, then B part is not there. Like that. I don't know whether it is my printer mistake also, but both in two
no,
test I tried.
actually the volume one was so confusing. Hope you remember
But
I told
volume
you.
one is so easy for
So
me.
easy. Okay. So no worries, I'm going to send you another file. Okay. Maybe it is no, I will just show
Like
you.
see, the first one, there is no part A. Direct they are started with part B and part C. Okay,
Going
the
to
first is in order. First they are writing the introduction.
mm-hmm. Okay, let me check.
Then hmm,
Okay.
the same like that only the next one also. There will say A part is there is a no B part. That's why I leave it that.
Okay, wait, but I can see the part.
Where? B part is there.
Mm-hmm.
Where is the A part?
See part A.
Where is it? My print is not saying that one.
A, B, C.
No. Just. Okay. B. Okay. A part where is that?
Here.
That I didn't fit in this print.
No, actually, compared to volume 1, actually, this is more like organized.
But why I didn't? Okay, then next one. Part test 5.
Part A is there.
Otherwise, my printer mistake maybe.
Yeah, no idea.
I got a part and
Mm-hmm.
means text A. Then
Mm-hmm.
I didn't get text B. Like a
No.
text B half only I got.
No, actually, when I look this PDF, then I can see everything. Okay, no problem. I have this one. I'm going to send you this. Here it is. Everything will be there.
Okay, no worries.
Okay.
I will take the printout.
I will just send it right away. Otherwise, I'm going to forget it.
Right, he sent it today. Take the question.
OET reading material. 13th July 2026. Please find the attached. I'm sorry. So yesterday it was not your holiday.
No. This week no.
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 So-
Maybe this not the last week. This week maybe. I don't know.
Sure. Okay, I'm going to send you the Google Drive link. You just click on that link and you will get the file. Just download it.
Okay.
Okay. Now let's start with our writing evaluation. I was just going
First
through
listening.
listening. Okay, tell me the patient name.
Patient name is Daniel.
Daniel Anderson.
Yeah. Mother of 6-year-old boy called Daniel. And the next one is Vincent Scott. Together only 24%.
It starts with a bit more tired.
Huh?
Is it?
What's the question? Can you read?
No, I'm just checking the answers only. Daniel Anderson, right?
Daniel?
Daniel Anderson.
Only here. Daniel Lemmings.
Okay. Daniel, can you spell it for me?
Lemmings. Daniel.
Daniel
MMIN.
Lemmin.
Cheers.
Lemon. Okay. Skin on Daniel's hands is both. That one, right?
Yes.
Okay. Start with cracked and dry.
Yes. Okay.
Second one constant.
Okay.
Bleeding.
Okay.
Winter.
Okay.
Hand washing.
Okay.
Petroleum jelly.
Ayyo. Jelly treatment I took.
Jelly treatment. Okay, not accepted. Then aqueous cream.
Can you spell it for me?
AQUIS, or you can write AQUEOUS.
Now, AQUIS.
That's also fine. Aqueous cream. Then school holidays.
Okay.
Then highly strung.
Highly strong.
Highly strung.
ST.
RUNG. Strung means
Okay.
the past tense of string.
Okay. Next
Then change. Germs.
Tense.
Germs.
Jones. Okay.
Then OCD.
Okay.
Moving to the next part. 13. Full. Choking. Watery. Gassy. Itchy.
Okay.
Lying down.
Okay.
Heartburn.
Okay.
High fat.
I wrote the fat stuff.
No.
Okay.
Paint factory.
Huh?
Paint factory.
Can you spell it?
Paint. P-A-I-N-T.
Paint factory.
Yeah, yes, yes.
Okay, I got it that. Okay.
Then
Correct.
hepatitis B,
Okay.
gallstones,
Okay.
diabetes 2.
Yeah, okay. 1 minute.
I think this listening is under control, right?
Ah,
I think
listening.
listening
I
is under control.
understand.
Yeah, okay.
But the thing is, now you see that the seventh one.
Hmm.
What I wrote means asthma.
Asthma. Why?
I don't know. Okay, the next one. Like that mistake is happened. Like I am confusing. 11th one, I wrote junk food. Like junk.
Why?
That's what I told you. I'm confusing.
Okay. Any more?
Sixth one I wrote already informed jelly treatment I wrote.
Okay. That is confusing, yes.
And 23rd fat stuff.
21?
20 fat stuff.
Fat stuff. Okay. Any other?
But the remain everything fine.
Okay.
Everything right.
Let me check the sixth one onwards. Okay. So sixth question is home remedies. Example treating with dash, right? Okay. So actually, if we even write like jelly, then it is fine. But of course, like jelly, petroleum will be needed because in the audio they are clearly mentioning like petroleum jelly.
Yeah.
Okay. And also,
Okay, that I understand.
yes, then seventh one, asthma, no. Uses his sister's asthma, no. Nobody can use somebody else's asthma. So it should be some object. Then 11th one.
First I wrote uses stuff I wrote. Then I cut it out.
Stuff, but yeah, that was the good thought, which means like I always tell you whenever we do any listening test, it's not about like we write anything. We have to know whether we are looking for a noun or a verb or the object, or is it a time, or is it a person. That is how we have to listen. Then Daniel is overly worried about dash. 11th one. What we wrote? Germs is the correct answer. Okay, then 20th one, has always liked dash food. We wrote fat food, right?
Fat.
Fat?
Fat stuff.
No. No, but actually that might be like, when we wrote in a hurry, then it got mistaken. Okay? Anyway, good.
Okay. No problem.
Okay, so now what you have to do is, now it is time that you can go with the part A and B, both.
Reading or listening?
Listening. Okay, next time when you do, then you have to do like both, and leave the last part. We are looking for 31. Once we start getting 31, then we will take last round as a free hit. That is how we are planning.
Hey, okay.
Inshallah. Okay, now
Letter.
yeah, letter. So the question is, where is the question? I sent you over the mail. Okay, okay.
Yeah, yeah.
Uh, can you tell me the question?
Question on sixth, I think. No. Robert Trump.
The last one.
Last mail you sent it
Last
me.
one was Henry Fletcher, right?
1 minute, I haven't. 6th July 6th.
July 6th.
Huh? I told you, I missed the one that I last time.
Mohan, actually, like I'm trying to send the PDF, but it is getting rejected because the file size is a bit higher. So shall I send?
Send me in WhatsApp.
I'll send on WhatsApp, okay? Because I think my Google,
Is full.
yes, it's full. Oh, okay, okay, no, 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 I got it, I got it. So why? Because I'm doing the videos and everything, and it is getting backed up in.
I'm watching YouTube.
You watch?
Yeah.
Oh, okay.
But it is most and IELTS of it. That's why.
Mostly, yes, yes.
Huh?
But we are going to start like the live sessions to be recorded and the content like doing the series as well.
Hmm.
Please wait, it's being uploaded. Okay, I have sent you.
Okay. Got it. Mail?
Yeah,
Reading you send her?
I just sent you the reading file just now.
Maybe don't take time.
You will receive it soon. And 3rd July, right?
6th.
6th.
Ah, yes, got it. Got it.
Okay, when you take the printout, just be careful and see everything is there or not. Otherwise, maybe.
It is very risk.
Yeah, yes,
I
yes, I know.
am finishing 11 o'clock duty. I will roam in here and there and I will start the printer in the last counter. And I will vanish. Nobody is going to the last counter. Just almost 169 paper like that. No.
Yes,
See,
yes.
this is a 554. Oh my god.
Okay, so this writing task is about Robert Lawson, right?
Yeah.
Okay. It is a progress update letter, right? Good. Okay, so the question is uh, non-patient, and he was discharged from Southport Hospital 10 days ago following CABG. You are the senior clinic nurse managing his outpatient rehab progress. Doctor's name is Alistair Vance. And medical history is also given. So what we have to do is, recent timeline is also given. Severe diaphoresis, then JVD, then bilateral fine crackles, vitals, ECG, management initiated at clinic. Okay. So what we have to do is, using the information in the case notes, write an urgent progress update letter to doctor. Do not use phone, not phone. Expand the case notes into full. Frame sentences to show an update on a sudden life-threatening clinical shift, and we have to write approximately 180 to 200. Now let's start with our answering. I'm writing to update regarding your regular patient, Robert Dawson, aged 62 years, following today rehabilitation section. He complaining of complaining of feeling sudden onset, full and unusual shortness of breath that started 2 hours ago. Okay, so actually I'm writing to update you, or I'm writing to provide an update on. That is better. I'm writing to provide an update on your regular patient.
1 minute, sir.
Yeah.
I am writing.
I'm writing to provide an update on your regular patient. And age 62 years, following today's apostrophe S, today's rehabilitation section. Not section, session. Section is different. Then full stop. Or if you're putting comma, then also is fine. He is complaining
Okay, comma is complaining
of experiencing, not don't use the word feeling, experiencing the sudden onset of. But actually it is better, like, it's a very lengthy sentence, so it's better, like, rehabilitation session, then full stop, then make this next sentence.
Okay.
Okay, so it will be like, I'm writing to provide an update on your regular patient, Mr. This person, comma, following today's rehabilitation session, full stop. He is complaining of this one.
Okay.
On examination, comma, his vitals are showing significant drop. On room air. 89% on room air, right? Okay, so actually, don't write like, this is showing. Okay, let's not write in like continuous tense. Just write like vital signs showed or vital signs reveal. Those words are better. On examination, comma. Okay, no problem. I'll just type and send you. I can use this,
Yeah, I will read now.
Oh. On examination, comma, his vital signs revealed a significant drop in blood pressure. Do not use BP. Okay, in blood pressure. Then put 90/60 in bracket, then mmHg in bracket.
In bracket only.
Yes.
Why
Comma.
like that?
Sorry.
Why like that?
Because if we are mentioning any measurement, then either you have to write like it revealed a significant drop in blood pressure which was 90 mmHg, or if you write like we are mentioning like there was a significant drop in blood pressure, and in the brackets we can show it was this. So when we use the brackets, that is better.
Okay.
Then comma a pulse of 110 bpm, then comma a respiratory rate of 26 beats breaths per minute, not minutes, minute,
Okay.
comma, then an oxygen saturation of 89% on room air. Write like that. Don't write SpO2 89%. Then an ECG performed, right?
Yeah.
An ECG performed immediately demonstrated ST segment elevation in leads V1, V4. Good. No changes. Very good. On 2/7/2026, he reported only mild expected post-operative soreness. His chest incision was healing well. He completed his exercises successfully and he tolerated his medication without difficulty. It is good. But uh, actually it is a very lengthy kind of a run-on sentence, right? So we could write like on 2nd July or 2 July 2026 in words. Coma, he reported only mild coma, not mild expected soreness. Mild coma expected post-operative. You can use like a hyphen, but if you can write as one word also, it is fine. Expected post-operative soreness. Full stop. His chest incision was healing well, coma, okay. He completed his rehabilitation exercises, not exercises successfully. He completed his rehabilitation exercises successfully and he tolerated his medications, not medications without difficulty.
Difficult.
Today assessment, he was pale, cold and dripping. No. On today's assessment, coma, he appeared. Don't use the word was. He was pale or he was panic.
I didn't get that word.
He appeared pale,
Okay.
then cold, and don't use the word dripping. Dripping is actually informal. We need formal word. We can use like there is a term like like instead of dripping there is a word diaphoretic.
I wrote that,
Yeah.
Then I think that is a cardiologist.
No, we need those kind of words. Or we can use like the words like he was sweating profusely.
Sweating, that is better, I think.
Yeah, sweating profusely is also good.
Sweating?
Profusely, PRO Fussely.
That is better.
It means like extremely. Okay, we can use it with something in an excessive amount. Like for example, he apologized profusely, or if it is related to some body fluids or something, then sweating profusely or bleeding profusely.
Okay.
Okay. Okay. Then jugular venous distension was noted, and bilateral fine crackles were heard at lung bases. His chest incision remained intact. Very good. But we can make it better. No. That is better. That sentence is better. Good. Then rehabilitation exercises were started immediately. No, actually, if you look at the case note, we can see rehabilitation exercises were ceased immediately. Right? It is not started.
Okay.
So you have to replace the word like started with ceased. CEASED. SED.
Okay.
Then students who are going high flow, okay, high flow oxygen administered via simple face mug was commenced, improving his oxygen saturation to 90%. Yeah, that is fine. But we can write, we can add one more sentence: high flow supplementary oxygen, and the rest is fine.
High flow supplement.
Supplementary high flow. When you write high flow, always try to use a hyphen.
Okay.
Okay, then he was administered 300 orally and one dose of something will be according to emergency protocol. Okay. So actually, like he was administered 300 mg. Actually, aspirin is there.
Aspirin orally and one dose of sublingual glycerin trade.
Okay, but that is not in the image. I cannot see it.
Where is your specs?
No. Actually, it is not there. അവിടെ വെച്ച് അത് തീർന്നു. I can see like a local that part.
That is, I will read. He was administered 300 mg aspirin orally and one dose of sublingual glycerin trade.
Trinitrate. Yeah, after writing sublingual glycerol trinitrate, then you have to write in bracket GTN.
GTN.
Yes. Then an ambulance was called at 10:15 a.m. and he is currently being transferred to Southbourne Hospital. Emergency clap. Very good. Then I would appreciate your immediate cardiology assessment and urgent coronary angiography upon his arrival. Only one mistake is there. The first is like when we write this these sort of terms, it's better to avoid like urgent coronary angiography, and angiography is a small letter. So make everything small letter. And upon is also like that. U is capital. Kindly provide an update regarding his diagnosis and ongoing management. No. We should not be asking anything.
It is like that only,
No. We should not be asking. Kindly provide an update regarding means tell me after this. No. We have to write like I would appreciate your urgent assessment and ongoing management of his condition. That's it. Don't ask for any kind of reports back. Then should you require any further information spelling, Please do not hesitate. Do not make it separate.
Okay.
Okay, now let's come to the knots. Okay, if when we look at the knots, then there are some missed points,
Hmm.
heavy crushing chest tightness. It's mentioned, but not using these words.
Hmm.
Then that is also mentioned. This is mentioned. Pain radiating, left jaw.
Hmm.
Okay, then pulse, irregular pulse, and there is something related to indigestion, right?
Yes.
Yeah, that is also missed. Okay, so actually, if we take this,
Indigestion, I wrote it in the first this one, no? It is experiencing sudden, overfull, and unusual shortness of breath.
first paragraph.
That is a scenario.
No, first paragraph or second?
Indigestion where they wrote it.
Sorry,
Indigestion where?
where?
Current status, patients have section of indication and shortness of breath. Second hours. That only, no?
Tell me which paragraph.
First,
First paragraph. Sudden,
I am
over,
writing the update.
full and unusual shortness of breath that started 2 hours ago. No.
The indigestion only I make it like a sudden overfull.
Sudden overfull.
Mm.
No. Actually, if we write like that, most of our sentences are very lengthy sentences, right? So what happens, he complaining of feeling sudden overfull and unusual shortness of breath means he's feeling something full and unusual about what? His breathing.
Okay.
So those will be combined.
Okay.
Okay, so actually, since we missed these points, we'll get maximum 330. But let's take it as 300 only. C plus. Okay, and some sort of like the missing comma and these sort of things that will also affect.
Actually, what the missing part, you know?
Hmm.
This print I didn't take. Okay, what happened? I wanted to go back read and I wanted to come
Okay, that's why we missed.
Yeah.
Okay, fine.
And
No
every
problem.
time I'm taking the printout, but I missed this one.
Yes. No, actually, we'll try one more. The same kind of update letter because we
Now
want.
no letter, you can send me new one. I don't have any.
Okay, so now we will start with our speaking session. That is.
I did that because I didn't realize it.
Okay.
Like that, rehabilitation notes.
Like
This is you only making this one.
Sorry.
I think you only making this questions.
Yeah, this is taken from the library. I have plenty of questions
Okay.
related to the patient's name. Because actually
from the hospital I am getting a call. 1 minute. Hello? I see.
Sorry?
ഇതാണ് എൻ്റെ ഡ്യൂട്ടിയുടെ കുഴപ്പം.
So you need to go now.
Yeah, no, they put me actually in today for the with the general doctor.
Okay. So
Just now they called me. You just go to the gynec doctor.
so nothing is fixed.
Nothing is fixed. That is the my. Actually, I'm starting the OET. That is the main intention in life. So
Inshallah, inshallah. Okay, so what shall we do with the speaking?
senior cardiac rehabilitation.
We'll do it, right?
Yes.
Yeah.
But I will read it.
Yeah, go through the question.
Background.
About the patient, you are 62 years old and had a major heart bypass surgery. What you have to do is dismiss your symptoms as nothing serious. Just
That
say,
is your part.
yeah, yes. So I'm writing my part. Sorry, I'm reading my part. Then show resistance, becoming angry, and only agree to cooperate. Then about the nurse's role, identify the relationship, de-escalate and command, explain the intervention, manage severe resistance, and secure absolute agreement.
Shall we start?
Yes, you may start.
Can you please share me that question paper in the screen?
Listening?
Question.
Oh, question. I'll send on WhatsApp.
No, share the screen.
Oh, acha. Okay, okay. I'll share your part. I hope it is visible. Okay, now you may start.
Good morning, Mr. Robert. Please
Morning.
come in. I'm one of the registrars in this clinic. It is nice to see you again for your secondary cardiac evaluation session. How do you feel?
Actually, it's just a bit of bad indigestion from my breakfast. I had some spicy eggs 2 hours ago, and it's repeating on me. So, but it's
Before we
okay.
begin, I
Let's not.
can see that you look very pale and you are sitting quite heavily.
Yeah, but it's not a big deal. I'm here to exercise, so let's get started.
Oh, I understand with you. You are thinking like that.
Hmm.
However, based on your symptom I am observing,
Okay,
I
come
am
again.
thinking we can do not continue with your today exercise.
Why not?
Why? Because the symptom is showing like you are very sweating and you are looking at pale.
Uh huh. Yeah, but what do you think? What should I do right now? I just came here for the exercise.
Based on your symptoms, it is not look like an can uh, we can't do this. We can't today continue. We are today exercise. Why? Because your symptom is showing like you have.
See, okay, I understand, but see, I don't think like I need any kind of oxygen or please stop treating me like an invalid kind of a person. If I sit down and rest in front of the whole class, then I will look incredibly weak. Actually, I'm a tough man. I can push through a bit of heartburn, no problem. I don't think it as a big deal.
I understand your concern, Mr. Robert, but it your symptoms like just tightness, shortness of breath, sweating. It will not showing like it is not an indigestion. It will
It
like
is just a
indicate of
heartburn.
that only I'm suggesting you.
Mm-hmm.
Maybe having we can like that ECG your previous ECG finding is, and we are showing like that you have a shortness of breath,
Yeah,
and now we are
okay.
looking at pale and sweating. It is the things look like maybe having a small heart related some symptoms. This is like a medical emergency we need without any delay.
Okay, so what should
And
I do now?
now the I will provide the oxygen that I will help you to the oxygen to give you that oxygen help to you that will reach your heart and your head blood flow. It will get regular and smoothly, and the treatments are essential there. We are waiting for any another like any.
See, if I put this mask and these sort of things, don't you think like it will make me look like a weak man? I'm just telling you, like, let's not make a big deal of this. I'm perfectly fine.
Yes, I understand, but I clearly told you, according to your this situation, it is we are treating like a medical emergency, and we will put using this oxygen. It will help of the your to make your heart like reaching the oxygen levels, and the aspirin help the reduce the blood clotting, which may improve your blood flow.
So, what do you mean by
These
this
treatments
emergency steps? What do you mean by that?
this emergencies what I mean was your condition could worsen suddenly. We will put effort in like it take like for the exercise we are doing, our condition will worse.
Okay.
Okay, we will step out first for the remain safety options, and we may remain stay safety still, and we will settle ground, then we will take the emergency treatments that is essential.
So you will be doing it from here.
I will arrange a call from the necessary team, and they will come here. And our doctor, cardiologist, their team is ready to treat you.
Oh, come on. No, 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 no. Do you mean like, some people will come here and they will take me to some other places, or, they will provide some kind of things? Just give me their address. I can go by myself. I can drive myself straight, I can go.
Mr. Robert, I must strongly advise against this driving or leaving the clinics. It is extremely dangerous. Your condition could worsen, suddenly putting your life into the risk. Kindly understand the situation. The safety option is stay here and remain. We will stay. Take the. We will take the remain. Take this option of hospital's team and advice from the cardiology department team. That is better for your condition. No need to worry. You are at a safe place.
Okay. Okay, so actually,
Okay. We will.
no, no, no. We need to talk. See, Mon, I always tell you, like, if the patient is a bit kind of a tough guy, actually, the first and foremost thing, like, we have to, here it is strictly given the instruction, like, we can command. Firmly
Mm,
tell the patient that he cannot exercise today, but at the same time, you have to use a calm but highly authoritative tone to command him to sit down. You didn't tell me to sit down and take rest.
mm,
The first point, identify the relationship. Open the session by greeting the patient by name. That is done. Acknowledge that this is his second rehab session, but
mm,
immediately not his pale appearance and sweating. That
mm.
was missing. So first point was missing, second point was missing. Then third point, explain the intervention. State clearly that he is showing signs of a cardiac event, not indigestion.
Mm.
Okay, and why this oxygen mask and chewing the aspirin tablet? That was missing. Then
Okay.
manage severe resistance. Confront his denial directly but empathetically.
Okay.
Explain the extreme danger of him trying to drive like home or leaving the clinic. There is a chance of cardiac arrest. And the last one, ensure he remains completely still, accept the oxygen, and agrees to the incoming paramedic transfer to see Mr. This doctor.
Okay.
So as per the purpose, no, we focused on to other points.
Mm.
Okay, every time I tell you, whenever we get an opportunity to talk about the feelings of that patient, then that is the opportunity for you to score.
Okay.
Okay, start like, hi, Mr. Robert, yeah, it's good to see you. This is a second rehab session, right? Okay, wait a minute. Start like that.
Okay.
Okay, after that, when he tells the things in a, oh no, it's not a big deal. Oh, of course, I can understand, like, you have the knowledge related to all these sort of things, but let me tell you, like, actually, we should not exercise today.
Okay.
Give the appreciation, and after that, like, talk like a friend, let me tell you. But I think, then ask him questions like, don't you think? And ask questions like, are you feeling like this, and are you feeling like this? No, 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 just to understand the situation. Then only we can start with the exercise.
Okay.
Got it?
Got
don't
it.
don't tell him like, no, no, you cannot do this, or you cannot do exercise. Just take the notes, like, okay, you experience this one, okay, then you experience this one. Okay, then there is a problem. I am afraid. Use the word expressions like this. Okay, Mr. Robert, I'm afraid, like, we have a situation here, but you need to be calm.
Okay.
Okay, then we have to state clearly that this is the sign of a cardiac event. Okay, then after that, the patient was resisting. Then just tell him like, okay, give me a minute. Come, please come. You please sit here. Nes, just sit. Then I will tell you. Okay. And as of now, I am putting on the oxygen mask because I need to tell you something. Okay. Then explain like, are you feeling now this? Okay. Any relief? Yeah, this is what happens like this. Okay, now I want you to chew this aspirin tablet. Okay, because as per the situations and the things you said, actually it is not just indigestion. So you must take this aspirin right away. Can you do it for me?
Okay.
Okay, and after that, be empathetic also. Because okay, he accepted this mask and had the tablet, but he's telling like, oh, don't call them, I'm going home. If there is no exercise today, no problem. Because we have to think from the patient side. What the patient is thinking, he just thinks like, I had this operation and everything is fixed right now.
Yeah.
Right.
That's
Yeah, every time like when you prepare for the speaking session, you have to know the mentality of the patient as well.
okay.
Okay, so as of now, like I understand what you feel, because even if it was me, I would also think the same. Like I just completed this operation and everything is fixed, but unfortunately, that is not the case. Or let's avoid the word unfortunately. Use the words like to be cautious or to be careful, or since it is only 10 days. Since it is only 10 days, don't you think like we have to be a bit careful? Then if the patient tells yes, then that is our like hand to prolong.
Okay.
Okay, then we have to ensure like okay, so as of now you agreed this one, okay, and you are doing this, okay, very good, okay, this, okay, very good, okay, now let's move to the next one. When you like when he says like okay, no problem, I'll wear the mask and okay, let them come, actually I didn't realize my life was in danger. Okay, then yes, Robert, thank you so much. You are making the absolute right choice. Your life is absolutely worth making a big deal over. I'm going to stay right here by your side, monitoring your pulse and blood pressure until this team walks through that door. Just breathe deeply and rest. Then the speaking session is over. ഓക്കെ, ഇത്രയേ ഉള്ളൂ. സിമ്പിളായിട്ട് ചിന്തിക്കാം. നമ്മൾ ഇവിടെ അയാളെ ഇംഗ്ലീഷ് പറഞ്ഞിട്ട് എന്താ പറയാ, അതായത് ഇംഗ്ലീഷിനല്ല ഇവിടെ പ്രാധാന്യത. ഒരാൾ പെട്ടെന്ന് വന്നിട്ട് എനിക്ക് പ്രശ്നമൊന്നുമില്ല എന്ന് പറഞ്ഞാൽ നമ്മൾ എന്താ പറയാ? സാധാരണഗതിയിൽ നമ്മുടെ നാട്ടിലുള്ള നഴ്സസ് ഒക്കെ പറയുന്ന കണ്ടില്ലേ, അതൊക്കെ നമുക്ക് പിന്നെ തീരുമാനിക്കാം, ഇപ്പൊ താൻ ഇങ്ങോട്ട് ഇരുന്നേ, റൈറ്റ്? അതേ രീതിയാണ് നമുക്ക് ഇവിടെയും വേണ്ടത്. പക്ഷെ ഇംഗ്ലീഷിലാകുമ്പോൾ അതിന്റെ കൂടെ ഒരു അപ്രീസിയേഷൻ കൂടെ വേണമെന്ന് മാത്രം. അതായത് കുട്ടികളില്ലേ, കുട്ടികൾക്ക് ഇപ്പോ ഇഞ്ചക്ഷനൊക്കെ വരുന്നൊരു പ്രശ്നം ഉണ്ടെന്നുണ്ടെങ്കിൽ നമ്മൾ എന്താ ചെയ്യാ? അവരുടെ ശ്രദ്ധ മാറ്റാൻ നോക്കും. എങ്ങനെ? അപ്രീസിയേഷൻ വഴി. Yeah, that is what you have to do here as well. Okay, every time like yes I understand, but understand എന്ന് പറയുമ്പോൾ താൻ അത് നന്നായിട്ട് പ്രാക്ടീസ് ചെയ്യണം. യെസ് ഐ അണ്ടർസ്റ്റാൻഡ് എന്ന് പറയുമ്പോൾ ആക്ച്വലി തനിക്കത് മനസ്സിലായിട്ടില്ല എന്ന രീതിയിലാണ് നമ്മൾ സൗണ്ട് ചെയ്യുന്നത്. Okay, no, we are discussing, okay, don't take it in a negative way. Yes, എന്ന് വെച്ചാൽ നമ്മളിപ്പോ ഒരു പേഷ്യന്റ് telling like in a very rude manner, like who told you to call these people, I can drive myself home. If you don't want me to exercise today, then okay, fine, I'm going home. Then we have to stop him. Don't say like I understand. No, actually there is nothing to be understood.
Okay.
Okay, we can use the other sort of expressions like, okay, let me be very clear with you. Okay, so make the patient very calm and quiet. That is our first aim. Then move to these other parts.
Okay.
പിന്നെ നമ്മൾ ഇതിൽ പോയിന്റ് വൈസ് പോകുന്ന സമയത്ത് കുറച്ചുകൂടി സ്പീഡപ്പ് ചെയ്യണം. കുറച്ചുകൂടി സ്പീഡപ്പ് ചെയ്യണം എന്ന് പറഞ്ഞാൽ, ഞാൻ ഇപ്പോൾ ശരിക്കും പറഞ്ഞാൽ ഈ റിലേഷൻഷിപ്പ് കഴിഞ്ഞിട്ട് നേരെ ഞാൻ കമാൻഡിലേക്കാണ് ചാടിയത്. എന്ന് വെച്ചാൽ തനിക്ക് കമാൻഡ് ചെയ്യാനുള്ള രീതിയിലുള്ള ഡയലോഗ്സാണ് ഞാൻ പറഞ്ഞത്. പക്ഷെ താൻ അപ്പോഴും ഇവിടെ തന്നെയായിരുന്നു. ഓക്കെ, എന്നിട്ട് ഞാൻ എന്ത് ചെയ്തു, വീണ്ടും പിന്നെ ഇന്റർവെൻഷൻ എന്നുള്ള രീതിയിൽ കാര്യങ്ങൾ പറഞ്ഞു. അപ്പോൾ താൻ ഇങ്ങോട്ടേക്ക് എത്തുന്നേ ഉള്ളൂ. അങ്ങനെയല്ല, നമ്മൾ നമ്മുടെ പേഷ്യന്റ് എന്താണോ പറയുന്നത് അതിനനുസരിച്ചാണ് ആയിരിക്കണം നമ്മുടെ റിപ്ലൈ. ഓക്കെ, അതായത് എൻ്റെ ഡ്യൂട്ടി എന്ന് പറയുന്നത് എന്താണ്, ഡിസ്മിസ് യുവർ സിംറ്റംസ്. അതാണ് ഞാൻ ആദ്യമേ പറഞ്ഞത്. ഓക്കെ, എന്നിട്ട് ഞാൻ പറഞ്ഞു ഐ ഡോണ്ട് നീഡ് ഓക്സിജൻ എന്ന് വെച്ചാൽ രണ്ട് അല്ലെങ്കിൽ 3 സെന്റൻസോട് കൂടി എൻ്റെ ആദ്യത്തെ 2 ടാസ്കുകൾ കഴിഞ്ഞു. Right? Stop treating me like an invalid. If I sit down, rest, and I will look weak. Okay, എന്നിട്ട് ഞാൻ ആംഗ്രി ആയി. എൻ്റെ 3ാമത്തെ പോയിന്റിലേക്ക് എത്തി. അപ്പോഴും താൻ 1ാമത്തെ പോയിന്റ് കഴിയുന്നേ ഉള്ളൂ. അങ്ങനെ ആകുമ്പോൾ എന്താന്ന് വെച്ചാൽ ഒരു ഇംബാലൻസ് വരും. ഇപ്പൊ അവസാനിപ്പിക്കേണ്ടത് എങ്ങനെയാ, നമുക്കൊരു കൺഫ്യൂഷൻ വന്നില്ലേ? അതെ, അതായത് we didn't get the idea like the patient is convinced or not. ഇയാൾക്ക് മനസ്സിലായോ എന്നുള്ളൊരു കൺഫ്യൂഷനിലേക്ക് എത്തി നമ്മൾ. അതായത് തൻ്റെ ഇത്രയും കാലത്തെ എക്സ്പീരിയൻസ് ഉണ്ടല്ലോ, ഈ എക്സ്പീരിയൻസ് വെച്ചിട്ട് ഒരാളെ താൻ മാനേജ് ചെയ്യണം. താൻ അതിലേക്ക് ശ്രദ്ധിക്കണം. ഓക്കെ, ഇംഗ്ലീഷ് അല്ല, ടേംസ് അല്ല, ഒന്നുമല്ല. നമ്മുടെ ഇത്രയും കാലത്തെ എക്സ്പീരിയൻസ് വെച്ചിട്ട് ഒരു പേഷ്യന്റ് വരുന്ന സമയത്ത് ആക്ച്വലി ഹൗ വി വിൽ മാനേജ് ഹിം. ഓക്കെ, എനിക്ക് പറ്റില്ല എന്ന് പറയുന്ന ഒരാളെ പറ്റും എന്ന രീതിയിൽ പറയിപ്പിക്കാൻ എന്താണോ നമ്മൾ സാധാരണ ചെയ്യാറ് അതാണ് ഇവിടെയും ചെയ്യേണ്ടത്. പിന്നെ ഓക്വേർഡ് സൈലൻസ് വരാൻ പാടില്ല, അത് പ്രത്യേകം ശ്രദ്ധിക്കണം. അതായത് പേഷ്യന്റ് പറഞ്ഞു കഴിഞ്ഞതിന് ശേഷം നമ്മൾ ഇങ്ങനെ മിണ്ടാതിരിക്കുക, അത് പറ്റില്ല. ഓക്കെ, ഇനി പേഷ്യന്റ് മിണ്ടാതിരിക്കുകയാണെങ്കിലോ, അപ്പൊ നമ്മൾ ഇടിച്ചു കയറണം. ഓക്കെ, ഈ ഒരു കേസിൽ പേഷ്യന്റ് ഇങ്ങനെ സംസാരിക്കുന്നതിന്റെ ഇടയിൽ പെട്ടെന്ന് നിർത്തിയെന്ന് വിചാരിക്കാം. അപ്പൊ എന്ത് ചെയ്യാം, പ്രിറ്റൻഡ് ചെയ്യണം. ഐ നോ വാട്ട് യു ആർ തിങ്കിങ്, ബട്ട് സീ മിസ്റ്റർ റോബർട്ട്, ഐ എം നോട്ട് ഗോയിങ് ടു ലെറ്റ് യു ഡു ദാറ്റ്. ഓക്കെ, യെസ്. അങ്ങനെ സിറ്റുവേഷനിൽ നമുക്ക് എന്ത് ചെയ്യണം, ഓരോ കാര്യങ്ങൾ പെട്ടെന്ന് നമ്മുടെ തലയിലോട്ട് വരണം. ഓക്കെ, എനിവേ you just practice. I will.
അതെ, എനിക്കൊരു കാര്യം, ഈ സ്പീക്കിംഗ് ഇപ്പൊ ഇങ്ങനെ പറയില്ലേ, ലൈക്ക് എമ്പതി, അപ്പൊ അതിനുള്ള കുറച്ച് സ്പെസിഫിക് സെന്റൻസ് കാര്യങ്ങൾ എനിക്ക്
എക്സ്പ്രഷൻസ് അല്ലേ?
എനിക്ക് അതൊന്നും പറഞ്ഞു തരും.
അതായത് ആക്ച്വലി ലൈക്ക് അത്
കാരണം ഞാൻ ഒറ്റയ്ക്ക് ചെയ്യുമ്പോഴും സ്ട്രക്ക് ആവുള്ളൂ, ഞാൻ വിട്ടിട്ട് പോയി ദേഷ്യം വരും.
അതായത് പൊലൈറ്റ് എക്സ്പ്രഷൻസ് ഉണ്ട് ഇംഗ്ലീഷിൽ. അല്ല, സംഭവം എനിക്ക് മനസ്സിലായി. അതായത് നമ്മളിപ്പോ ഉദാഹരണത്തിന് നമ്മളൊരു ബാഡ് ന്യൂസ് പറയാൻ പോവാന്ന് വിചാരിക്കുക. ഓക്കെ, അപ്പോ നമ്മൾ എങ്ങനെ തുടങ്ങണം? ഇനി അതല്ല, അവര് ഒരു കാര്യം ചെയ്തു, അപ്പോൾ നമ്മൾ അതെങ്ങനെ പിന്നെ അപ്രീഷിയേറ്റ് ചെയ്യണം. പിന്നെ അതുമല്ല, സപ്പോസ് ദ പേഷ്യന്റ് ഈസ് ക്രൈയിങ്, അപ്പോൾ നമ്മൾ എന്ത് പറയണം? ഇനി അതല്ല, നമ്മൾ പിന്നെ കമാൻഡ് ചെയ്യാണ് ബിക്കോസ് ഇറ്റ് ഈസ് എൻ എമർജൻസി, അപ്പോൾ നമ്മൾ എങ്ങനെ പറയണം? ഇതിനൊക്കെ ആക്ച്വലി ലൈക്ക് ദർ ആർ മെനി എക്സ്പ്രഷൻസ്. പക്ഷേ അതിൽ ഏതെങ്കിലും ഒന്നേ സെലക്ട് ചെയ്യാൻ പാടുള്ളൂ, അതർവൈസ് യു വിൽ ഫീൽ കൺഫ്യൂസ്ഡ്. See, for example, like suppose the patient is crying, അപ്പോൾ നമ്മൾ എന്താ പറയാ? Don't say I understand. No, I can see how. Yeah, I can see how deeply distressing this situation is for you. ഇനി അതും അല്ലെങ്കിൽ ലൈക്ക് ജസ്റ്റ് തിങ്ക് ഇൻ എ സിമ്പിൾ മാനർ ലൈക്ക് ഓക്കെ ഐ സീ യുവർ സിറ്റുവേഷൻ പ്ലീസ് ടേക്ക് എ ഡീപ് ബ്രെത്ത് യു ആർ ഇൻ ദ സേഫസ്റ്റ് പ്ലേസ് റൈറ്റ് നൗ.
അപ്പൊ അതിന്റെ ലിസ്റ്റ് ഉണ്ടെങ്കിൽ എനിക്ക് അയച്ചു തരാം.
Yes. I'll send you the expressions because we have the lexical resources file with me. Okay? Yeah, it's why because see എല്ലാ മെറ്റീരിയൽസും നമ്മുടെ കയ്യിലുണ്ട്. പക്ഷെ ഇത് ഞാൻ കൊടുക്കാത്തതിൻ്റെ കാരണം എന്താണെന്ന് വെച്ചാൽ പിന്നെ നമ്മുടെ കാൻഡിഡേറ്റ്സ് എന്താവും ലൈക്ക് പിന്നെ ഡ്രാമാറ്റിക് ആവും. അതാണ് പ്രശ്നം. ഓക്കെ, പക്ഷെ അതിലുള്ള ഏറ്റവും നാച്ചുറൽ
ലെറ്റർ എഴുതുന്നതിന് മുമ്പ് സത്യം പറയാം, ലെറ്റർ എഴുതുന്നതിന് മുമ്പ് എനിക്ക് തന്നില്ല ലെറ്റർ ഡിഫറൻസിയേഷൻ. എല്ലാ ലെറ്ററിന് മുമ്പ് ഞാൻ അത് വായിച്ചിട്ട് ലെറ്റർ എഴുതാം.
ഓക്കെ, പക്ഷേ അതിൽ ശ്രദ്ധിക്കേണ്ട ഒരു കാര്യം
ഒരു കോൺഫിഡന്റ് വരുന്നത് മീൻസ് ലൈക്ക് കുറെ പ്രാവശ്യം ഞാൻ അങ്ങനെ പ്രാക്ടീസ് ചെയ്യുമ്പോ ഓക്കെ ഒരു 20 അല്ലെങ്കിൽ ഒരു 25 മീൻസ് എന്റെ ഒരു എക്സ്പീരിയൻസ് അങ്ങനെ 25 ലെറ്റർ കഴിയുമ്പോ എനിക്കൊരു പേപ്പറിന്റെ ആവശ്യം വരില്ല, ലൈക്ക് ഒന്നും കൂടെ തറവ് ഇതാവാൻ. ഇങ്ങനെ എന്റെ മൈൻഡ് സെറ്റ്.
Yes. Okay, no problem. I'll send you that file. Okay?
ഇന്നലെ അയക്കണേ.
Yeah, sure. I'm on it. I'll just send you right away.
പിന്നെ ഒരു ലെറ്ററും.
One letter. And what about speaking? Question needed?
Speaking
and writing, then this PDF, right? ഇനി ഞാൻ മറക്കുക വെച്ചാ ഒരു കുട്ടീനെ ഇങ്ങോട്ട് ചൊല്ലി അയക്കുക. Okay, we'll sit tomorrow. Let me know the timing.
Tomorrow and duty 1.
Okay, so 11 o'clock is fine tomorrow. Yes. 11 or 10, fine.
11.
11 is fine.
ഞാൻ 10-ലൊക്കെ ലെറ്ററിനോട് മൽപ്പിടുത്തമായിരിക്കും ഇവിടെ.
Okay, fine. Okay then, we'll see. Okay, bye. Have a nice day. Yeah. Okay guys, I hope you got an idea how this speaking is done. My candidate, she's a very joyful person. I really like her enthusiasm. She's ready to work on everything. So whatever I say, she's very capable of grasping what I say. So I hope you got an idea, especially related to writing and speaking.